afternoon and good morning and warm welcome to all of you to the fourth episode of 2024 edition of our talk show series, Let's Talk Primary Healthcare. Today we are going to highlight the important role of primary healthcare play in maintaining public trust in vaccination, addressing the concerns of caretakers and parents and patients. Our guest today will address the complexities of the vaccine hesitancy and also stress the importance of utilizing primary healthcare for building vaccine trust and confidence and effective response to vaccine hesitancy. Our panelists also will share their experience and also will bring stories from the field, highlighting the essential role that primary healthcare workers play as a very trusted source of information on vaccination. And I would like to use this opportunity and to maybe before introducing and handing over to our expert panel and our keynote speaker, I would like to make a few practical arrangements. As usually, we invite all of you to our breakout sessions that start right after our talk show. It will be hosted in English and Russian, and we hope it will be a good opportunity to discuss, to express, to exchange your experience and ask questions. In the meantime, please use chat to say hello, and our colleagues also will be able to share some interesting and useful links for you. With this background, I would like to welcome our panel and introduce our speakers. Siddhartha Sankar Datta, Regional Advisor, Vaccine Preventable Diseases, Immunization, Division of Communicable Disease, Environment and Health, WHO Regional Office for Europe. He will share WHO views and support provided for countries. Gabriela Fontana, Regional Health Advisor, UNICEF Regional Office for Europe and Central Asia, will speak about complexity of our topic and via the health system lenses. Gayane Sahakyan, National Immunization Program Manager from the National Center for Disease and Prevention, Ministry of Health, Armenia. She will bring country perspectives. Urania Kolokotroni, pediatrician, assistant professor, School of Health Science, Cyprus University of Technology, member of European Forum for Primary Care. She will share her extensive experience in this area, working with primary health professionals and parents. And Irina Kaskova, she is a cultural mediator. She works with refugees in Romania. She will share the voices from the field based on her personal experience. Dear colleagues, vaccine hesitancy is a concept that has been discussed for years and have often referred to the low vaccine uptake. My question goes to Siddhartha. You are the regional advisor at Vaccine Preventable Diseases and Immunization and WHO. Could you please, from your perspective, help us to define what is vaccine hesitancy and what role does primary health care play in this regard? Please, the floor is yours.
Yeah, thank you so much, Igor. A warm greetings to each one of the participants who have joined this talk show from Copenhagen. Before we go into discussing the vaccine hesitancy per se, I want to take a step back. And if I look into the vaccination coverage of the WHO European region, 2019, almost 96% of the children born in our region received a dose of measles. And obviously in 2022, the number went down by a couple of percentage, but it's still around 93, 94%. What does that tell us? It tells us that the parents and the caregivers and the community in overall are accepting the vaccines. They are coming forward and getting these vaccines. And to make this happen, the primary healthcare professionals, the doctors that we have, are playing an immense role in making sure that they all receive this vaccine. Since 1974, the vaccination program has prevented almost more than 150 million deaths. And that is the value of vaccines that we are talking about. However, as we talk about 95%, 93% receiving the vaccine, there is a proportion of our population who are not coming forward and getting the vaccine. And just to spread the context of this vaccine hesitancy, it is context specific, it is time dependent, and it is vaccine dependent. So it is not a one-term broad stroke. It is related to different vaccines that we can talk about, or even the time specific. Today, a person may have a concern and may not come and get the vaccine. Tomorrow, that can be related to a different vaccine or a different time frame. So just wanted to outline this. And when we talk about people having hesitation in getting a vaccine, it could be linked to the convenience of accessing the primary healthcare services, or it could relate to their own concerns around the safety around the vaccine. Again, coming back to the point that it is not one size fits all. We need to really take a very close look when we talk about vaccine hesitancy. The other one is when we are trying to understand this vaccine hesitancy, as we will be doing this today with a different panel, it is critically important that we start understanding the reasons why people are not coming and getting the vaccines. And that is extremely critical. And where primary healthcare plays such an important role in this process. I, as a medical professional, I know that my population would trust me very much because I'm closer to them. And all the surveys that we have done now shows one critical important thing. My primary healthcare professionals are the most trusted in the population group, in a community. And that stood still for throughout the period of COVID-19, but also before and after. And I think as we look into different country settings, high income, middle income, lower income, the setting is exactly the same. The primary healthcare professionals are the backbone of this service delivery. So I feel as we start this discussion, vaccine hesitancy is not a one singleton term. We need to look into all the layers that come into why people are not coming and getting vaccine. That should be a starting point of our discussion around vaccine hesitancy. I pass the floor back to you, Igor. Thank you.
Thank you very much, Siddhartha. I think thank you for, getting some figures, some trends. But from these trends, we can see that, people trust and parents go for vaccination and vaccinate children. But of course, you also open up the complexity of vaccine hesitancy. And this phenomena should be really to look from different sides and, and scrutinized to address this. Thank you very much. And I would like, with true pleasure, to hand over to our keynote speaker, Rob Butler, Director of Division of Communicable Diseases, Environment and Health from WHO Regional Office for Europe, who, with his high policy level expertise, will help us to set the scene on the agenda. So, with great pleasure, Rob, the floor is yours.
Thanks very much, Igor.
Welcome.
Thank you very much. I hope you can hear me okay, Igor.
Yes, absolutely.
My apologies for being late. I think Siddhartha said much of what I wanted to say, apart from the fact maybe that we should acknowledge that this phenomena is not a new one. I think most of you know the story, but in 1796, Edward Jenner used cowpox matter to induce an immune response for the far deadlier smallpox with an 8-year-old boy by the name of James Phipps. Now, that actually was the birth of the vaccination program as we see it today, but the birth of vaccination full stop. Cow in Latin, vacca, became vaccination, and vaccination was born. As Siddhartha said, hundreds of millions of lives saved. Just in the last 50 years, 154 million since the birth of the expanded program on immunization. And as we're aware, since 1796, not just many lives saved, but smallpox itself eradicated in 1979. A single Jenner vaccine is now we have 25 vaccines available to us and 15 in the pipeline. But what I wanted to say was, as vaccination was born, so too were the concerns and the opposition. And these were religious, these were political, these were scientific. The mandates that were introduced in the UK in 1840 and 1853 were the first time that we saw this mass population anti-vaccination league. And this wasn't a small group of people. This was 80 to 100,000 people convening in places like Leicester in the UK in 1860 to push back against the vaccination drive as they saw civil liberties really challenged by the vaccination program. Thankfully, it's not as widespread today, vaccine hesitancy, but it's still here. It's still active. But mostly the same arguments that were made 230 years ago. It's still, however, incredibly damaging. We've got high vaccination coverage across the European region of 53 member states we serve from WHO's regional office here in Copenhagen, but pockets of subnational susceptibility in populations, as we've seen, emerging in and resulting in outbreaks of measles and pertussis consistently over these last 2 years. Contributing to this, of course, is vaccine hesitancy. And as Siddhartha said, this is complex. This goes beyond just a lack of trust in our vaccines. It extends to lack of trust in the authorities that deliver them and lack of trust in our health systems in some cases. Alongside complacency, apathy, people becoming rather complacent around diseases that they do not see circulating in their environments and in their communities on a day-to-day basis. So they begin to question why they should vaccinate their children or themselves in those circumstances. If you like, vaccines have indeed been a victim of their own success. So caregivers, parents, individuals' concerns are, of course, most evident and apparent at this interface or this interaction with healthcare workers. And as Siddhartha said, it is the healthcare workers that are really the pivotal point of contact between the caregiver and the health system. They remain the most trusted source of information and our most trusted source of advice in any society, and they have an absolute vital role in vaccinating in some cases, but also in promoting vaccination in their communities. Of course, WHO and partners such as UNICEF and many others support member states, ministries of health, health authorities in protecting the health of individuals from vaccine-preventable diseases. Here in the European Regional Office for Europe, under the European Programme of Work, our immunization program is a flagship. It's one of 4 flagship programs, such as the importance, because we acknowledge that immunization vaccination programs are indeed the very foundation block of any health system and the health of the people that it serves. But that is totally dependent on healthcare workers, and particularly healthcare workers at primary healthcare level. It depends on their skills, their abilities to address concerns, which are legitimate concerns, as I'm sure we will all acknowledge today in this discussion that we're going to have, legitimate concerns of community members. And they are absolutely pivotal and critical, those primary healthcare workers, in maintaining, sustaining public trust in vaccination. And of course, communicating the safety and the effectiveness of vaccines. So they're pivotal, crucial agents that we need to depend upon. Today, we're going to hear from experts at the front line about strengthening primary healthcare and immunization, and understand some of the complexity that Siddhartha just referred to in terms of how complex vaccine hesitancy is, and how healthcare workers continue to play this heroic role in addressing it and assuring health and well-being for everyone. Thank you. I'll pass the floor back to you, Igor.
Thank you very much, Rob, for this comprehensive overview with historical look back at the history of vaccination and vaccination programs that actually really it's impressive way. And thank you for this, excellent introduction to our discussion today. Thank you very much. And with this, I would like to go back to Gabriele. Gabriele, so I understand that vaccine hesitancy is influenced by multiple factors that are context-specific. And we would like to hear your thoughts on this and some other insights, unpacking vaccine hesitancy, which started by Siddhartha. And I would like to hand over to you, Gabriele, please.
Thank you so much, Aigul, Rob, and Siddhartha. And indeed, I would like to build on what Siddhartha was sharing and Rob had referred to. I think we need to deconstruct hesitancy. What's behind it? What's in it? We need to understand what are the drivers of the concerns and behaviors in different groups in relationship with immunization, and even within groups. There are no cookie-cutter solutions. Let me give you a couple of examples from the experience on the ground. When we started supporting Ukrainian refugees 2 years ago, fleeing their country and going into what we call the first wave countries, Poland, Slovakia, Czech Republic, Hungary, Moldova, Romania, the countries where they transitioned to, we knew that in Ukraine, many people had concerns and hesitancy about vaccines. And we saw different reactions once they came in European member states. Some of them decided to vaccinate their children because they felt that they were receiving vaccines from Europe and they were more comfortable with the quality of those vaccines. And so they started vaccinating their children. Others had completely different concerns regarding the safety and the effectiveness of vaccines. And so they still decided not to vaccinate their children, which created, in some cases, issues for their children to access schooling, etc., that we jointly overcome over time. But that tells you that even in a group of population that you might think is homogeneous, very often you need to take your time and understand what's behind the concerns and the behaviors. Another example, Roma families. What we have discovered in some countries, we see, okay, the Roma community has lower vaccination coverage than the general population, and we need to communicate to them better. In some cases, we realized that the issue was not the understanding of what is the importance of vaccinating their children, but the fact that they were not comfortable going to a health facility where they didn't feel welcome. When we brought the vaccines to the community, vaccination coverage went up to the level of the general population. But mind you, in other circumstances, in other Roma communities, bringing the vaccine to the community was not a good idea because they felt that we were bringing them a different vaccine than the one that was provided in the facility. We had not built trust with the community, so they were doubtful on the quality of the vaccine that they were receiving and what would be in it. So a third example is vaccine hesitancy and misinformation online, where different arguments resonate with different population groups. And sometimes it's safety, sometimes it's the nature of the vaccine. So to sum it up, as we work to improve the vaccination uptake, and we need to provide sound information to parents or caregivers, but we need to really be nuanced and have that dialogue and trust relationship with parents or caregivers so that vaccine can be understood, accepted, and taken up. Over to you.
Okay, thank you, Gabriele, and I would like to thank you both, Siddhartha and Gabriele, for helping us to explore the terminology used and applied, and also drawing our attention on the vaccine hesitancy versus vaccine confidence. And as you mentioned both, I mean, it's a wide range of factors that actually affecting vaccine acceptance, decision to accept to make vaccination or not. And yes, we have to really to look carefully at individual and specific population segment behaviors aspect. Thank you very much. And with this, I would like to move to the next round and together with our panelists to elaborate on challenges and primary healthcare practice. And again, I would like to start with, I would like to refer to what Rob mentioned. Rob, you mentioned that and several times emphasized, I mean, a pivotal role that primary healthcare providers play. Whatever sources people can, use, apply, listen, mass media, social media, internet, eventually they go to the health provider, they listen to health provider, and this person actually at a kind of, a final point that actually people believe and trust. So I would like to ask you, Siddhartha and Gabriele, could you briefly reflect on what role of primary healthcare workers play in building vaccine hesitancy in public? Siddhartha, please, you can start.
Yeah, thank you so much, Igor. And I see this as two-stroke. The first critical important is for a vaccine to become a vaccination. This is where the primary healthcare professionals play a critical role, as you have heard from Rob and also from Gabriele. The important element is the primary healthcare professionals, the doctors, the nurses, the pediatricians, and everybody, all health cadres, they are not only giving the vaccines, they are also promoting the vaccines, as you have heard. I would also want to take one step further. After giving the vaccines, they are there to give a trust to the community that if something happens, I'm here for you. And this is critically important in a vaccination process, because when we move into a vaccination center, we bring in a healthy individual, we bring in a healthy child. And we need to have that confidence that if I'm receiving this vaccine and if tomorrow something happens, I can fall back on this health system who is there. And this is built around this whole vaccine confidence, as you're talking about. I'm receiving the vaccine. Do I have a confidence that the vaccine is safe? Yes, because I'm receiving it from the doctor, from the nurse, whom I trust. But if tomorrow I need some help, whom should I go back to? And these are all integrate policies around which the primary healthcare is, as you have heard from Rob say, they are pivotal. They are the central pillar in any trust building exercise. The other part, which I would say is this mechanism of building this confidence, again, is multidimensional. It's not a single context. It is based on what my belief system is. It is what is the belief system of the community, belief system of this individual, belief trust on the system as a whole, but trust on the primary health care. These are all dependent around this topic. But let me take it from the other stroke now. So this is from the healthcare side. The other stroke is from the public, from the community. A person who is coming to the health center to receive a vaccine, or for that matter, any healthcare delivery, is a healthcare seeking behavior. We should see that this as a positive step moving forward. I am coming to seek health. And this healthcare seeking behavior also comes with some questions. Because if I'm coming and receiving a healthcare service, be it vaccine, be it medicines, they can also come with some questions or concern. And this primary healthcare professionals who is sitting there as a custodian of health in that healthcare center or a setting will play that big role in ensuring that I can receive, number one, a trustworthy information, and not from information from my neighbors or relatives or from the digital world. As you know, we are all living in this whole digital community where is information overload. So that is not the best source to get this information from. And then, it's not only giving an information unidirectional, it is a dialogue. And this healthcare seeking behavior, contact with the primary healthcare center, provides this immunization, provides this optimal platform to have a dialogue between healthcare provider and the community. And we cannot not recognize how powerful this platform is, how powerful this interaction is. Vaccines and vaccination, Aigul, is becoming overtly complicated now. COVID-19 is a great example. As the COVID-19 pandemic evolved, the vaccine also evolved. There were so many uncertainties around COVID-19 vaccination. We were learning as COVID-19 vaccination was rollout was happening. During that process, these primary healthcare professionals, my doctors, my nurses, the pediatricians and everybody played that critical role in explaining in very, very simple terms how the vaccine was effective, what the vaccine was doing, but also telling what the vaccine would not do. And I think it is critically important in this, when we talk about the role of primary healthcare workers, is to be transparent, but also give scientifically trustworthy information to what this vaccine can do and what the vaccine cannot do. And WHO has been very fortunate to work with partners, but also with so many of our member states. We have learned from them, and we have developed now a communication module in terms of communicating with healthcare workers on COVID-19 and others. How do you communicate? It is not about knowing what to communicate, but it's also important that we know how do you communicate. And I'm sure other panelists will also throw light on it, so I don't want to go there. But let me summarize and in the role, when you talk about the role of primary healthcare workers, in summary, I feel, this is my own personal feeling, is that each and every primary healthcare worker, primary healthcare professionals are micro-influencers in their community, but they have a macro impact on the whole community and the delivery of the primary healthcare services. So they're micro-influencers with a macro impact, a bigger impact when we talk about the vaccines and vaccination in a community. I pass the floor back to you, Aigul.
Thank you very much, Siddhartha. I think central word you mentioned is partnership, because partnership between the patients and communities from one side, and also health provider, primary health care provider and health system on another side. Without this partnership, we cannot address properly vaccine hesitancy and vaccine confidence. Thank you. And I would like to give floor to Gabriele. Gabriele, your reflections.
Thank you, Aigul. I will very quickly complement the good points from Siddhartha that I obviously share with some experiences from the ground. I think we all agree that primary healthcare workers are indeed a trust source of information for most people, and they are our most precious champions. Now, health workers need to be equipped with the answers to challenging questions on vaccines. And for that, they need on one end to be familiar with the answers, and on the other, to have the skills to communicate effectively and build that trust with parents and caregivers. And this is achieved through pre-service training and in-service training. Now, when we have done workshops with health professionals to provide them with their tools, sometimes we've registered down to 40% attendance. So I think we need to make sure that the capacity building efforts that we put in place are relevant to most health professionals to support them in their task. Also, I've seen more and more now in countries and across countries, some caregivers come with printed letters asking for me information that is very technical on vaccines that very often they're not even equipped to understand because it's not been explained to them. They find them on internet sites from anti-vaccine groups that spread fear, and this is put to the face of the health professional in a vaccination center, and it's virtually impossible to answer all those questions. So what we've done is, and I've seen these documents are the same in multiple countries, they're just translated as they are. So we have developed printed document with specific and simple answers to those technical questions. We need to make this tool available to all health professionals to support and comfort parents and caregivers. So I think support our health professionals is the key, as they make a world of difference and they're our main resource. Over.
Thank you, Gabriela. Very interesting points, and thank you for your contributions, especially that understanding and careful reading of the public and parents' concern is crucial. And of course, despite many other sources, health providers equipped properly with the skills, competencies and information and well-crafted messages on vaccine and, vaccination can definitely be a very helpful and the most trustful source of information for public. Gayane, you as a manager of National Immunization Program, could you please share your thoughts on what primary healthcare workers also need to be effective on building vaccine confidence? Please.
Thank you, Aygul. As the National Immunization Program Manager, I would definitely emphasize the importance of healthcare providers' communication skills and also their personal values, such as dedication to their work, patience, the ability to listen, caregivers, parents, understand their concerns, their questions, and communicate with them simply and clearly. As my colleague Gabriel mentioned, to be effective in building vaccine confidence, healthcare workers have to consistently and continually develop their professional experience and knowledge. Not just to be happy what they have learned before. Also, they should use their trusted information from trusted sources. They always should look for evidence-based information on vaccines, on immunization, just while replying to questions and concerns to parents and caregivers. From my country's perspective, I would also emphasize the significance of healthcare providers' self-confidence on vaccines, because even within the same health facility, if health worker is vaccine confident, they can successfully inspire their trust to population among the public. So, just to summarize again, we should say that the most trusted source of information is healthcare workers.
Mm-hmm. Thank you, Gayane. I think it's very good and interesting, your observation as a manager on national program. And of course, as you mentioned, training, but also, probably well-shaped educational programs are crucial because it should be built all the time, consistently. Thank you. And now I would like, to ask Urania. Urania, you have been organizing multiple discussions with the health providers and parents in Cyprus. And you were trying, to explore, what challenges primary healthcare workers face during their convincing different group of population, different patients in accepting vaccine and vaccination. But also you also discuss a lot regarding what needs actually primary healthcare providers need to support them. So what you would like to highlight in particular?
Yes, thank you, Aygul, and thank you for the opportunity to participate in this talk show. We in Cyprus were part of a constructive advanced thinking project where we tried to understand. One of the cases of this project was to understand the training needs of healthcare professionals in primary care on dealing with vaccine hesitant individuals. And specifically, we targeted primary care professionals because, as the other panelists very highlighted, we know that they are the more trusted source of information for their patients. So basically, we developed a Delphi study where we tried to assess the training needs of healthcare professionals in primary care on how to conduct effective consultations with vaccine-hesitant individuals. And the results of our study came down to 4 specific thematic areas where primary healthcare professionals wanted training to enhance their skills. And of course, one was the communication skills area that the other panelists mentioned, and more specifically on how to communicate risks to patients and how to communicate in a cultural competent way, because now all our societies are multicultural, and this element is very strong. And then the other thing that they mentioned was about behavioral change techniques. They wanted to learn more about how to use these techniques. So one area was communication. The other area was how to address misinformation. And I think Gabrielle mentioned that as well, that they need tools, they need access to tools, access to information on what are the current myths that are going around and how can we deal with those myths. Then the other area was obviously how to answer questions on technologies about development of vaccines and safety of vaccines. And again, they felt that they lacked the competency in this area, and they needed more training. And then the last area was about the individual factors, individual behavior, the drivers, the concerns, the behaviors of vaccine hesitant individuals. They wanted more training on those elements so that they can work better in how to deal with these individuals. So these were the thematic areas that came out from our study, and we're currently embarking in other projects as well. One of the European projects that we're running now is the Cooperator project, where we will try to develop a virtual hub with information, with effective ways that people have found, have developed in addressing vaccine hesitancy.
Thank you, Urania. I think it's you highlighted the needs of primary healthcare providers, and of course, currently, health providers need more skills. They need more sophisticated approaches, more tailored approach, like motivational interview. So they need more skills. Yes. To reach to each of patients. And with this, I would like to hear the voice of practice. And Irina, you are closely working with refugees in Romania, helping them to reach out to the essential health services. But also, can you, from your experience, from your observation, can you also share some stories, maybe some situation that actually can reflect and describe complexity of vaccine hesitance? And also, I mean, you're working with individuals, but also with a group of population that actually affected. So please, I mean, share your ideas, your observation.
Thank you very much. I truly believe that we need to use individual approach. What I often observe is that sometimes people are not against vaccination in general. If we are talking about displaced population, quite often I see that sometimes people just cannot provide necessary documents and to get these vaccines, or they're concerned about quality of the vaccine or conditions of their storage, or they're not sure that they can get this vaccine for free. So I think in this case, it's quite easy to allay these fears. Much more difficult when we are dealing with people who are under the influence of social media that believe that vaccines cause disease or something, because we never see on social media messages that my child lost the ability to walk because of polio and doctors offered us vaccinations, we refused. Never. I have never seen these messages. So I think it's quite important to educate people. Like, for example, in December in Romania, we had epidemic of measles, and we launched a measles vaccination campaign. I can't say how many discussions I had with the parents and how many times I've heard that measles is just fever and rash, nothing dangerous. My child will be lucky, we will never meet measles, or we will deal with it. But when we told them that measles is 98% contagious, when we gave them the list of possible complications, how many children have been already hospitalized in Romania, absolute majority of parents told us, please help us to get the vaccine. Also, I think it's important to educate people, not to wait them to come and to ask. Almost every second woman that approaches our family doctor's offices doesn't know about HPV vaccination. And we don't wait them to ask. We offer them to protect themselves against cervical cancer, them and their daughters. And we give them example of Australia, when it is safe, where the incidence of cervical cancer decreased significantly. We tell them about hepatitis B. Not all people know about hepatitis B. Not all know what is cirrhosis and what is the cancer of liver. But if to tell, sometimes we even show photos if it's necessary. We have a lot of cases where when parents told, okay, we want to have our child vaccinated and we want to be vaccinated ourselves. We didn't know that it is so easy to get this disease. And also, if we are talking about displaced population, so vaccination is not first priority for them. They are concerned about accommodation, food education, and others. So we need to offer. I believe that this individual approach to their fears, individual approach to every person, it helps to build trust. And to make them confident in their decision. We shouldn't insist. We should support and provide them with our support and make them confident. Thank you very much.
Thank you, Irina. Thank you for sharing your valuable and personal observations from West experience, working with refugees. And as you showed to convince, people and the health workers have really to have a wide range of skills. They go deeper to understanding of the reasons, of the fears. And of course, they have to operate with evidence-based information. And as you mentioned, they have to really to refer some, decisive, some very clear and relevant country examples to convince people, yes, to turn to the, vaccine acceptance and also, be capable to respond different questions. And it was mentioned by all of you. Health providers have to respond to many different questions, because questions are different. They come from different people and they really different, and their concerns related to cost or safety or access and or deep understanding what are the what are the complications of vaccination, or what you should expect if your child is vaccinated timely. Thank you very much for this round of our discussion. Now we enter the last round of our discussion, and my question goes to Gabriele. Gabriele, what can be done by primary healthcare systems to support more health providers so that their positive influence is maximized?
Thank you, Aigul. And since my hand was raised at some point, it was totally unintentional. Apologies for that. Indeed, the promotion of immunization does not rest only on individual health professionals. Health systems at central and local level often lack the capacity for promotion and prevention health activities. In order to assess the drivers of care-seeking behaviors and of hesitancy or confidence, in order to design user-friendly services and to be convincing in their communication, we need to support institutional capacity for that. Sporadic promotion of immunization through communication campaigns can take us only so far. I also want to point out that beyond frontline health workers, politicians and managers in the health system need to build trust in the population. During the COVID pandemic, we saw that when a government had more trust from the population, vaccination uptake was higher. We saw it in Portugal, we saw it in other countries. Finally, health professionals need to be supported, incentivized, and even protected. Sometimes there are aggressive actions that are against vaccination. And there are mechanisms that health system can put in place to ensure that the individual health professional is not exposed and is backed up when necessary by the health system. Over to you.
Thank you, Siddhartha. Yes, health providers are not alone. They should be supported by primary healthcare system to really to make their job properly. Siddhartha, can you continue just on support of that primary healthcare workforce need from the health system?
Yeah, thank you so much, Igor. Just to build upon where Gabriela was mentioning, I cannot agree more that this has to be an all of the society approach when we talk about equipping the primary healthcare workers with all the tools that are necessary. But let me also shed some light on a different perspective, which I'm sure our attendees of this talk show would relate to. We are talking about a health workforce which is very tired from the last couple of years. We know there is a shortage of healthcare professionals across the board in all the countries of our region. We recognize that. And when we talk about immunization, giving them all the technical communication trainings and others, we need to see what immunization is doing today in terms of capacity building for technical activities or for motivational interviewing or other things. What is the advantage of that for the other health programs? Because the same health workforce will also be delivering mother and child health care services, the elderly care health services, and the treatment. So I think this should be seen as an investment in the healthcare system for the primary healthcare professionals, because whatever is being done in the immunization area will also have a positive ripple effect for the other healthcare service delivery. It's not like if you're giving a motivational interviewing for vaccination, this can also be used for other healthcare services being delivered at the primary healthcare level. So just wanted to outline that. And this motivational interviewing is a technique which WHO, UNICEF, and others who have been working for years now, and WHO has developed several modules and training. It is sort of not enforcing the fact. It is sort of listening and addressing the concern. And what I was mentioning earlier, provides a platform to have a dialogue, and that builds on what we had been telling about building a confidence on the healthcare system, on the primary healthcare level. The last point would be when we are talking about this training or the giving the tools, we feel that instead of only in-service training, we all should now move to pre-service training. And because even before a healthcare professional enters the primary healthcare, we need to start doing with nursing courses, pharmacy courses, even at the medical graduation course. I think this is all building through that confidence you need when you go and deliver the services at the primary healthcare level. I pass the floor back to you, Andrew.
Thank you, Siddhartha. I think you also brought many good points, and you mentioned that actually health providers also feel some tiredness, especially after the years of COVID pandemic. And you are right, because this is actually created additional health system constraints, increased overload, little time for in-depth consultation, and it's little time to listening to patients and for understanding their real, concerns and needs. I think all these needs, systemic thinking and effective operational solution. Thank you very much for this round of our discussion. And now I would like to move to the final stage. We have to come to the final part of our discussion, and I would like to ask your reflections on today's conversation. Could you please highlight one, maximum two, key messages that you would like, our audience that with us today will take home? And can we start with Rob? Rob, please.
Thanks, Igor.
Speaker.
Thanks very much, Igor. I'm going to be very naughty. I'm going to take 3 take-home messages, if I may,
yes.
but I'll be very brief.
You're allowed as a keynote speaker.
Thanks, Igor. First of all, thanks to all the speakers. I think what I've heard are 3 key messages, take-homes. This is complex and context-specific, and it has to do with more than merely confidence and trust in vaccines themselves. It has to do with complacency, people's risk perception, and also convenience. So 3 C's that we used to refer to: confidence, complacency, convenience. And the convenience factor relates to how easy people find it to vaccinate themselves or their children, whether it's culturally appropriate, whether it's affordable. Gabriele gave a very nice example from the Roma community. Irina did the same in terms of the Ukrainian migrants. So it's very complex, but more importantly, it's very context specific and population specific. So the importance of measuring it and diagnosing it at a local level before we take action is very important. Second point, let's be careful with this phrase vaccine hesitancy, because it suggests that the problem is theirs and not ours as public health providers. So we have to take some responsibility, or more responsibility. We can't use vaccine hesitancy to apportion blame. Nobody's to be blamed here. We have to be sensitive, understanding, and we have to have empathy when we are dealing with people's concerns around and lack of knowledge around vaccination and the impact of vaccination. And the third point relates to that. Healthcare workers deserve our support and continued investment in their capabilities, because this is as much about the soft skills as it is about the tools and the hard facts. We need to be able to maintain contact with those caregivers. Those healthcare workers are critical, as everybody said, are absolutely critical to the success of every vaccination program. It's crucial that they maintain contact with those caregivers, that they apply empathy, sensitivity, understanding, and ensure that the next time that caregiver has a concern, they look to their healthcare provider and their primary healthcare worker for the answer to that question. That relationship is so important, and it's so important that we protect it. So those soft skills, as important as the hard facts, there's a lot of tools, information I can see that's been shared in the chat, but I just wanted to finish with those 3 points. It's complex and context specific. Be careful on how we use the term vaccine hesitancy. We shouldn't blame individuals for their decisions or their concerns. And the third point is, let's continue supporting the heroes on our front line of every immunization program, who are the healthcare workers, of course.
Rob, thank you. Excellent. 3 points, key points that you brought to the end of this talk show. I would like to ask Gabriele, and then followed by Siddhartha. Please, Gabriele.
Thank you so much. I will stick to one, so we balance it out. Okay. Build trust is key, and primary healthcare workers are at the forefront of this effort. Through dialogue with their communities, with strong support from the health system, primary healthcare workers will make the difference for vaccination uptake to effectively protect all children from vaccine-preventable diseases. Thank you.
Thank you. Siddhartha, please.
Yeah, thank you so much, Igor. So from my side, I feel the first message that we should all leave this talk show with is vaccination or immunization is one of the most cost-effective public health intervention that we talk about. Yes, we are talking about vaccine hesitancy today, but we should not leave this talk show for not having that confidence that immunization or vaccination is one of the cost-effective, and vaccines do work. But vaccines to become vaccination, that is where I believe the primary healthcare professionals will play a big role. And that will come from building confidence and trust in the population group who actually are the recipient of this vaccine. So these are superbly interconnected to one another. And as we say that the population believes healthcare workers and the primary healthcare workers, the most trusted ones, they go to them. I would say for all primary healthcare professionals, please be ready. WHO, UNICEF, and partners are there to provide you all the required information trustworthy. So whenever you are in doubt, relate to this trustworthy information that we already have on our hand. You don't have to go anywhere else. The resources are available for you. It's a complicated world, It's a very much complicated than what it was in 1974, but don't be disheartened. There are resources available for you to fall back upon. Thank you.
Perfect. And now I would like to invite Gayane, followed by Irina. Gayane, please. Unmute, please, your microphone. Yes.
Thank you very much, Ayu. I'm just trying to document whatever we say in all countries. The most reliable source of information are health workers. So we should build our strategies, our capacities around the health workers. Just remembering that health workers with strong vaccine confidence, they can help us, can help our public health care systems.
Thank you. And Irina.
Thank you. I think it's essential to make an assessment of concerns and needs of different group of population before going to action. It's first. And second one, primary healthcare workers are the most trustful source of information. They need to be educated, but also protected and supported.
Thank you. And Urania, please, we would like to listen from you.
Yes.
Key messages.
Yes, so my message to the primary healthcare workers who are watching us is that you are the most trusted sort of information, as all the other panelists said. So it's important for you to invest time to train yourself so that you are so that you have the skills, you have the knowledge to be able to work with individuals who are hesitant to vaccinate, not because they are against the vaccines, but as the other panelist says, just because they have some queries, they have some questions, they have some concerns that we should be able to address them. So invest in training.
Thank you very much, dear speakers, dear panelists. I mean, you made, at the end, such an excellent, compilation and summary of very strong messages that I believe, our, people, our listeners, our participants of the talk show will take. And by the way, can discuss also in the breakout sessions right after our talk show. So I would like to thank you again, our dear panel and also speakers for your valuable insights, for inspiring experiences, for joining us for this, talk show to discuss this topic. Because, this topic and these issues that we discussed today has a paramount importance for building, developing strong quality, good quality and effective and accessible healthcare systems. So thank you very much again. And now I would like to invite our participants to the parallel deep sessions to give your visions, your feedback. It will be an excellent, platform for exchange what you've heard, what you know. We would like, to also to listen from you. Did this discussion actually resonate with you? Would you like to ask maybe some our panelists who will join, hopefully some of them will join the breakout rooms, and participants directly, and how does experience in your regions or in your countries maybe differ from what you heard today? So we are exciting to discuss with you in these deep dive sessions. So the links to the English and Russian deep dive session are posted in the chat. We will keep, the main webinar window open until this, all of you will join the breakout sessions. When you disconnect, you will get a survey in a pop-up window. So it will be very important, for us to get your feedback, to know how we are doing, and what other topics you would like to discuss. And please fill it in both English and Russian. And with this, I would like to say goodbye for now. Thank you all for your attention, and see you soon in the breakout sessions.